So good afternoon and welcome to the University of Toronto Joint Centre for Bioethics seminar series. My name is Ross Upshur. I'm a member of the Joint Centre and a professor and division head here at the Dahlana School of Public Health. And I'm delighted and thrilled to be the moderator for today's special session. Our speaker today is Ms. Rose Mwangi, and this seminar is entitled, How Prepared is Africa for Ethical AI Implementation? Bridging the Gap for Responsible Progress. Before I introduce today's speaker, I'd like to let you know that the seminar is being recorded. And this lecture, along with other archived lectures, can be accessed through the Joint Centre for Bioethics YouTube page. And I encourage you all to go and watch some of the sessions if you haven't been engaged with them, because they're all of high, uniform, excellent standards. And before we start, I'd like to give the land acknowledgement. I wish to acknowledge the land on which the University of Toronto operates. And for thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. And I'm grateful for the opportunity not just to work on this land, but to live and to raise a family. And particularly as we are coming to late spring and up to the solstice, you can really connect with the land in ways that we can't in the winter, say, because we have availability to all of the flourishing of the plants that are growing. And it's quite a remarkable experience to have. Now it's my great pleasure to introduce today's speaker. So Rose Mwangi is a behavioral scientist and bioethicist whose work focuses on Pan-African bioethics, integrating both qualitative and quantitative approaches to explore empirical aspects of bioethical questions. Her research and writings address the critical challenge of inadequate training and ethical conduct for researchers in low and middle income countries. She advocates for bioethics training that is informed by regional and local cultural expertise and designed to meet the urgent need for effective regulatory frameworks and robust research ethics review processes, especially in the context of high disease burden and rapid growth of biomedical activities in these regions. Ms. Mwangi has co-facilitated the African Vaccine Regulatory Forum, AVRF, in collaboration with Multi-Regional Clinical Trial Center of Brigham and Women's Hospital and the Harvard MRCT Center, focusing on training for ethics review of clinical research. She also serves as the ethics mentor for several international collaborations supported by the European and Developing Countries Clinical Trials Partnership, the EDCTP, the National Institutes of Health, and co-chairs the College Research Ethics Review Committee at Kilimanjaro Christian Medical University College. As a bioethicist, she has established herself as an influential figure in bioethics. She is passionately committed to advancing healthcare ethics, maintaining a diverse bioethics community, and exploring intersections with medical institutions. And her goal is to cement the future of bioethics in Africa, drawing from the best of the past while expanding the field scope and relevance. And I got to know Rose. I'm just going to be a little autobiographical. She's here visiting the University of Toronto because she was awarded a prestigious traveling fellowship from the Global Forum for Bioethics and Research, which is funded by the Wellcome Trust and the World Health Organization. And I had the great pleasure of having her in one of my breakout groups that I facilitated at a meeting in Cape Town. And so we've been delighted to have Rose here for the past 6 weeks. And on behalf of the Joint Centre and the University of Toronto, Rose, welcome, and I'll hand over to you. And thank you so much for being with us and for taking time to present this seminar. Over.
Oh, thank you for the beautiful words that you've put in my introduction. As you see, my name is Rose Mwangi, and I am coming from Tanzania, Kilimanjaro Christian Medical University College. And this presentation today will serve as a platform to explore the current landscape and strategies aimed at bridging the gap for responsible progress in the integration of AI technologies across Africa. So you all welcome to Kilimanjaro Christian Medical Center. It is popularly known as KCMU College, and it's located at the city of Moshi near the base of Mount Kilimanjaro. And you can look at the mountain on the top of our administrative building, or if you're bold enough, you can go up the mountain. So you're very welcome. Kilimanjaro Christian Medical University College is a center for excellence in training quality health professionals who deliver health services to a diversified and dynamic national global community. Why do I say this? The Kilimanjaro mountain is a huge tourist attraction, and a lot of times we also get collaborators who have come to climb the mountain and who are visiting the Kilimanjaro, and they also happen to be academics or researchers. So a quick background of what KCMU College is. It was started in 1997 and currently known as a very good institution for medical training in Tanzania, and I can say East and Central Africa. We are recruiting, we are admitting different students, and primarily medical and health sciences. And we also largely do in research, medical research, and this has attracted a lot of North-South collaborators from the EDCTP, National Institute of Health, among others. And it's worth mentioning that the KCMU College exists under the KCMC. This is the Kilimanjaro Christian Medical Center, which is a referral hospital that provides medical care to the local communities all over Tanzania and serves as a teaching hospital. So now we have the medical school and we have the hospital. And our mission is to provide an enabling environment for innovative and high quality teaching, research services, and responsive national and global needs. And as a Christian university, love, mercy, compassion, integrity, transparency are our core values. We have different undergraduate programs, and as I mentioned, we have a Doctor of Medicine. We are producing about 200 medical doctors every year, and more than 150 MDs every year. We have master's courses, and also we have PhD programs. So to summarize what you're going to talk about today, the summary sets stage for a high and in-depth exploration of Africa's ethical AI implementation. We highlight the insights and strategies for navigating this evolving landscape, and we want to provide recommendations for ethical AI adoption in Africa. So I think this is something that has been in our backyards, and AI becomes a global phenomenon, capturing everybody's attention. It has also potential to revolutionize the sectors such as health and education. But the lag behind in progress is further complicated by the African significant underrepresentation in global AI conversation. I'll explain why as we move on into the other slides. But within this context, there's a varied readiness for AI adoption in Africa, highlighting regional disparities. But even with the challenges, we realize that Africa still has the potential to harness AI-driven growth in Africa, because it can help in medicine, promote medical research, improve the overall well-being for African populations. So this discussion today, we will implement and identify ways to bridge the gap for responsible progress of AI deployment. Setting up some objectives, I think we need to assess the infrastructure. We need to raise patient privacy, bias, and equity concerns. We need to develop a curricula and for training and to increase AI ethics awareness. And we need to promote partnership and resource sharing for equitable AI access. This slide, I should mention that during my 6-week stay here, I was privileged to attend seminars, conferences, workshops, discussion with the faculty and University of Toronto people who actually gave me a lot of insights and inspiration. And this slide highlights The Africans are the representation in AI, the geographical disparities, and the regional variations in AI adoption in Africa. And in listening to the conversation, I find that South Africa and Northwest corner of the continent have been representing Africa quite a lot, which to me is a bit different when you compare with Tanzania, Malawi, and other countries. I would say that South Africa and some of the countries like Egypt on the top, they are much more advantaged and nearer to Europe and America than Malawi and Tanzania. So these are the kind of the representation you're talking about. And I happened to attend the Absolutely Disciplinary Conference by SRI, and one of the noted gaps was that one of the speakers, I think I got his name, Peter Lowen, speaking on global public opinion on AI and insights from AI index reports, he talked of two worlds when referring to the AI deployment and implementation. And one of them was the optimistic about AI and those who are pessimistic. And I really felt like telling him, please add a third world of the don't know much category. I think that's where we are in Africa. Stand to be corrected. Nickerson's global survey on attitudes towards AI self-reported opinions included 21 countries in 12 languages, but the global survey included Asia, Australia, North America, and South America. Africa was missing in the global survey. So we need to think about this missing from Africa. Talking about unique challenges on AI deployment and implementation, we need to provide equitable deployment in Africa, requiring to address infrastructure disparities, bridging the skills gap, and overcoming resource limitations. We need to develop and implement ethical and regulatory frameworks tailored to the African context. And that is if we have to ensure that AI development aligns with the global ethical standards benefiting everyone worldwide. And there are a lot of things that we have to think when it comes to the ethical considerations of AI applications in healthcare and regulatory frameworks in Africa. I think we need to be very, very cautious when deploying AI healthcare in Africa, and this is due to the complex ethical landscape. If we are borrowing from the medical model that we are very much used today, the main question that came to my mind was like, we are teaching bioethics every day, every other day, and we are teaching about international guidelines on ethical principles that have been, we are guided by the International Conference of Harmonization, the Belmont Report, the Helsinki Declaration. And the question is, do we need to review them to explicitly address unique challenges posed by AI technologies? When I look at them, I am not seeing something concrete about AI ethics in these guidelines. The new treatment risks and harms. We need to know how we can identify them. And if this is an African thing, we are always talking about human is to error. Sometimes we have the wrong foot, you have operated the wrong finger, you got the wrong eye, all those errors. And we can easily say human is to error. So who takes responsibility when we happen to come to AI technology? Addressing the medical errors also involves comprehensive approach that respects the principle of beneficence, maleficence, professional integrity, and commitment to patient safety and quality of care. So we need to strike a balance between innovation and patient safety in primarily in navigating the complex landscape of AI ethics in healthcare. We have more ethical questions. I think we'll have many of them, but this is just the current ones. Do we need a set of clinicians who use the AI stethoscope, for example? We need training programs that are essential to equip clinicians with the skills needed for the AI technologies in healthcare delivery. And when it comes to financial challenges of AI initiatives, how do we ensure that the AI systems are culturally sensitive in providing culturally competent care and improving patient outcomes? We are asking now, as social scientists, what are we going to teach? Social science can actually contribute to valuable insights into optimizing doctor-patient interactions. In the era of AI, we're disseminating this knowledge in rural communities. How do we communicate AI in rural settings of Tanzania, for example? I want to think that I need even to translate AI in Swahili. So we want to ensure equitable representation of Africa in AI development indices. So I think this is something that we really need to think as we move on with AI and technology. We are proposing solutions, and one of them is actually education. And we are not alone. The WHO's prioritization of AI ethics in global healthcare and research emphasizes AI's potential to enhance health coverage and outcome. They have also stressed the importance of ethical education for healthcare professionals. And I'm quoting something very recent. The Director General said the rapid growth of AI underscores the urgent need for the roundtable, which will drive collaboration to harness AI for health while ensuring a focus on justice and inclusion and protection for human rights and privacy. So I think this is very timely because we are actually echoing what WHO is planning to do. And this was just the other day for the All for Health, Health for All, the government investment case in the WHO Assembly on Strategic Roundtable. That was last about a week or so. They have also indicated that the Global Health Initiative on AI for Health, which they call GIA for Health, 2026 to 2030, will strengthen AI health systems for health, opportunities, and governance. We have other guidelines like for the UNESCO and other country-specific frameworks, which have highlighted essential resources in promoting ethical AI practices in healthcare. We want to bridge the gaps in ethical AI for healthcare in Africa. And there are some of the challenges that are related to adoption of AI in healthcare. A lack of awareness. We need to know, what is the level of knowledge? Are people aware of what AI can do in our healthcare practices, in health research? We have a knowledge gap, insufficient understanding of the AI risks. We need to have that. We have lack of practical AI assessment skills, diverse ethical considerations, and we still need to have continuous learning on what is remain updated on the AI technologies and where we are moving forward. So in bridging these gaps, we need to emphasize the importance of developing a tailored AI ethics curriculum that considers local context, empowering professionals with both clinical and technical skills. We need them to understand the foundation. Where are we coming from? Where are we now? And where are we? What direction are we moving? We should also emphasize the necessity for collaborative efforts and targeted investment to address AI-related challenges effectively. But we must set priorities for ethical AI initiative for Africa. And I would argue that education is key. We say knowledge is power. we need to prepare for AI complexities, especially when deployed within the health sector. How do we get education? We need to know what they must know, what they should know, even the basic knowledge before we can move to advanced knowledge and specific knowledge. We need the ethics guidelines to enhance the ethical oversight. And this includes reviewing our ethics standard of operating procedures to be able to say this is the ABCD of ethics. We need ethical AI research. We need to identify potential biases and concerns. And above all, we need to be trusted by the communities and promote collective action for health. Above all, what I'm trying to say here is that we need to start simple. We don't want very complicated models. Let's have simple models, simple tools for data storage, for security, simple AI technologies that can be implemented, and then let's move from the ground up. So we are proposing solutions, but we have to start somewhere. And as I mentioned, that we need to start with the educating the health professionals. If we are talking of AI deployment in health, the health professionals need to be educated. They need to know the basics. They need to know where they're moving towards. They need to know the risks. They need to know how to identify the risks and the harms. They need to know how to be accountable while using AI technologies in medicine. And we are coming up with a tailored AI ethics course curriculum, for which we think that this is the basic, this is the foundation of understanding what AI ethics in health and research means. And I must say, this is work in progress. We're still drafting up, but I present here what we think the health professionals, research ethics committee members, and medical students should know. The course will equip participants with essential skills to navigate the challenges in AI implementation, enabling responsible AI use in health research and in clinical practice in low and middle income countries. So we are recommending the audience to be medical postgraduate students, because these actually are the future policy makers. And once they do this as a part of their training, they'll be ready once they go out there. The practicing health professionals, researchers, research ethics committee members, and we're saying that this being a foundational course, then we can further tailor it for other target groups, like policymakers, Ministry of Education, Ministry of Health, and I put there community representatives who are the community advisory boards. These days, when you're going to do a research, you have to show, even any grant is demanding that you show who you are going to work with in the community. And the community advisory boards have become like the key gatekeepers as you move. So if we're going to talk about AI in the community, I will take a number of community advisory boards and start explaining to them what is AI, and I have to do that in Swahili. So then that's why we need it to be simple in a way that we can simplify it further into the community of where people may be semi-literate. We have retired people who are very advanced and who are very educated. And we also have both the young men, women, girls, adolescents, everyone. Those are the people we're going to be doing research with. So we need to understand. And that's why I'm calling all collaborators to work with the Kilimanjaro Christian Medical University College. I'm targeting University of Toronto because that's where I'm right now, the Daralana School of Public Health, the JCB, the Education Initiative, everyone I have talked to, the PEP, academic, and WHO, and we are open because I feel that the agenda for training AI ethics in healthcare is really urgent, and WHO has agreed in their meeting last 2 weeks ago. So in this course, we aim at equipping health professionals and researchers with fundamental skills in ethics. And the main objectives will be describe fundamental AI technologies and their ethical implications. We want them to understand the principles of transparency and accountability within AI context. We want them to ensure patient privacy and data security. They can't say we didn't know because we've been taught this is how we're gonna do it. We need them to be able to identify and mitigate bias in algorithms, AI algorithms, and be able to apply ethical decision-making frameworks. So we propose some content. Very briefly, I'll go through this content. We have come up with 5 key topics that we think will be fundamental for the health professionals, research ethics members, and postgraduate students in medical schools. So the first one, and I said this is work in progress, so I would welcome any inputs that you think they must know. This is a kind of, I call it the must know. We are teaching bioethics, history and evolution of bioethics. Where are we coming from? History, we are saying that there were some atrocities that were done before. We are talking about AI right now. What is the relationship? We want them to know the importance of the digital transformation era, so that when they will embrace knowing, oh, this is something we are told and we know about it and we want it to be systematic. Who are the key players globally? Africa is quite underrepresented. So we want to know who are the key players and what is the current status. Globally, we are not much there. Africa, institutional level, we want to be heard, but who are the global players? Addressing ethical dilemmas in AI implementation is key. We'll give them case studies on how they can do that. The next topic, we want the emergence of AI ethics. I think whenever we get to talk to them, we want to ask them, why ethics, AI ethics, and why now? And when I attended a conference at the University of Guelph, I think that's the pronunciation. It was a response to a question on doctor-patient relationship, and this presenter was talking about decision-making and trustworthy AI computer-assisted surgical interventions. And the answer was interesting because she said, we are avoiding that question. This brought this topic again. Clinical AI ethical principles and key concepts. Where are we coming from? What are the types of AI and their applications? Ethical frameworks of AI in research and healthcare. We cannot avoid this question for long. We need to answer the question. Another topic would be ethical excellence in integration of privacy, security, and key considerations. In this discussion, we want to address the algorithm bias. We want to ensure informed consent. We want the application of the 4 principles: maleficence, beneficence, autonomy, and justice. We want to talk about how we can maintain the doctor-patient relationship even when we are using AI technologies. The last but one, we will be talking about emergency situations. These are the same health professionals who will be called to respond to emergency situations. We need to let them understand how does it work, collaborative initiatives and network. The transparency in AI model used during pandemics, and who should be held accountable. We want to make sure that there's no one taking advantage of, I don't know what to say advantage, but we want people to be accountable for AI-driven decisions that impact public health, even during emergency situations. And what kind of framework should we have to ensure ethical accountability in the deployment of AI in emergency situations? Last but not least, We want them, everyone, and this includes the audience and everyone who is thinking about doing research, the social responsibility of the global health researcher. And this from Africa, Asia, North America, everywhere in the world. We have to have at every stage of AI development and deployment, we have to have ethical considerations that AI technologies are beneficial, fair, and aligned to societal values. Continuous monitoring and impact assessment, role of research ethics committees, they have to scrutinize of the ethical aspects of AI research proposals and monitoring the ongoing projects for compliance on ethical standards. Above all, we are encouraging research integrity. And this is for everyone. It's not for Africa, it's for the world. Honesty, transparency, and accountability through the whole research process. Integrity. Even when we put some money in it, even when we put some commercialization in whatever devices that we come up with, if we want to protect the human race, we have to come up with, keep our research integrity. Because we also need further research to ensure ethical and responsible AI in Africa by doing ethical research. And this, we all know that it requires scientific validity. We know it requires careful thought and careful planning to protect the human subject. We will never, somebody mentioned that you'll never compare the human race with anything else. And as I mentioned earlier in this presentation, history can repeat itself because we are teaching about the atrocities in the past. We are talking about the Nuremberg trials. We are talking about all those things. And now we have AI. We are talking about ethics of AI. But if we are beginning now and we want to take care, we can take care of the beginning because then I think the end will take care of itself. I wish to acknowledge the Global Forum on Bioethics in Research, the GFBR, and the World Health Organization, through which this fellowship was supported. The Kilimanjaro Christian Medical University College, where I'm teaching students and ethics committee members and researchers, and where I'm based in Tanzania. I wish to acknowledge the University of Toronto, particularly the Dalalana School of Public Health, the Joint Center for Bioethics, and all faculty members at the University of Toronto who dedicated their time to meetings at the University of Toronto. I wish to have special thanks to Ross Opsher and Jude Kong for their invaluable mentorship and guidelines. I have met so many people, I've attended many workshops, seminars, and webinars and conferences by reference. And last but not least, I would like to thank Terry Ewan and Chris Akodi. Since I came, I've been having a perfect administrative support, and I am really appreciative of my time here. Thank you very much for listening.
Well, thank you, Rose, for your presentation. You've introduced me to elements on campus I didn't even know existed, and I think you've been a fantastic networker and have met with so many people, and it just illustrates how much is going on in AI at the University of Toronto. It's really quite breathtaking. So now it's time for question and discussion. We have ample time to explore further and pick up on some of the themes that Rose has introduced. So if you have a question or a comment, particularly constructive comments as to how to build out the curriculum, now is the time to put it in the YouTube chat. And if you aren't logged into YouTube or wish to ask a question anonymously, you can send your question to the following email address, jcb.ea@utoronto.ca. So that's jcb.ea@utoronto.ca. And this email address has been posted in the chat for those of you who are joining via YouTube. So there's been a couple of questions raised, but while I'm pulling those together, Rose, I was wondering if you could, in a perfect world, outline how you'd like to see when you get back to Tanzania, how you'd like to see the ongoing collaboration with the University of Toronto continue. What would be the optimal way for us to continue our collaboration?
Yeah, thank you, Rose. I foresee a situation where we will need experts in AI and ethics to train our professionals. So part of the collaboration would be sharing of the resources, whether online or physical, if you happen to be around. I think training is a key component, and listening to different people who are exposed to AI in the call it global north will be very important for us to have that kind of sharing resources and even developing this further and to keep talking. And even the other thing will be the research component of it. We need to engage in research, even to find out even the level of knowledge our professionals have. I feel like research will inform what you're going to do later.
Great. So I have another question. So one of the things that this is my question I've noticed there's been a lot of attention to the concept of sort of epistemic injustice in the sense that many voices are either not heard in the language in which they're spoken. And it's something that we've experienced at the Global Forum for Bioethics and Research, and that's you know, I was struck on your first introductory slides about the almost complete absence of African voices informing the discourse on artificial intelligence. But that doesn't mean that there aren't people thinking about it or there aren't voices. And maybe if you could sort of explain a little bit about what unique contributions you believe African bioethics which is emerging as a distinct field in and of itself with different values and approaches. But what distinct features you think African bioethics can bring to the AI table that isn't there now? As you note, it's quite very much focused on the traditional North American, European bioethics. Have you had any chance to think about that?
Yes, quite a bit. I must say that looking at the other representation and me happening to listen to this, it means that being represented means getting some of the African representatives to be in these conversations. And I think that the representation should actually look at there are some people who are trained in bioethics. There are people who can contribute enormously to these discussions, but maybe they are not invited to that table. Even looking at the round table, I'm sorry to say that listening that I didn't see much of Africa being represented, and I was wondering who speaks for Africa in this round table, for example. I am yet to see. I listened until to the end, trying to get someone to speak for Africa, and I didn't get. And this is a World Health Organization, so I think we need to involve to find out who is capable out there, who can actually represent Africa in the conversation, and look at who can talk about the context that we want AI, especially in health, deployed. The context might be missing, and maybe and the tools we want people to talk about what can work in Africa. I think that's what is missing, and we have people who can actually take care of that.
And it's also worth noting, like the International Association of Bioethics is having its meeting, and they installed Cesar Atueri, a colleague and friend of mine from Ghana, as the president, and he's the first Black African president of the International Association of Bioethics. So I think we'll start to hear more voices emerging. So we have some questions coming in. So one question and a comment, fantastic presentation, and loved the comment on translating AI to Swahili, which was a thing. So is the course that you're developing only for medical professionals? And how can this be extended to community members, since that it was a really important component of your presentation? How would you envision rolling this out to the community?
Yes, thank you for that very, very important question. And as I mentioned from the beginning, the curriculum would be foundational for health professionals to start with. But I also mentioned that we can tailor that to take to the community advisory boards, because the community advisory boards, the way they are selected is they are selected or appointed by their own members. They are usually people who can change opinion. They are opinion leaders. So we can tailor that information, be able to put it even in Swahili in a way that they understand that this is a, may I or related research, and this is what we want. So it is the foundational, but we want to use that. Maybe this one they don't need, because they don't need to understand how clinicians work with this gadget, but they need to understand what is it gonna do for them? How can you participate in a way that you embrace that kind of technology? If you tell a mother to put some gadget in the ear for the rest of the day, and then they don't understand that the child's temperature is being taken all through and through, then they just remove it. Then they will not really, we need some simple language to explain to the community advisory members and to the community. And this curriculum can be shaped, can be tailored from where we are right now. Thank you.
Great. Thanks. So a couple of related questions. One observation that there is a few AI-powered projects already going on in Africa. And do you know if ethical considerations have been put in place for those current projects?
As I mentioned, and that's also a very valid question, we are having digital health, research related to digital health. We are also getting research that researchers coming in and collaborating. But I said that is what we don't know. We don't know because we don't have a database. And I think that is a question that we need to step up and say, this is what is on the ground. This is the level of knowledge. This is what you are doing. And maybe even assess some of the tools that are being used or the models and whether they are fitting the African context. I think this question can only be answered by a research, a directed research, so that we say, this is evidence-based. We can talk about AI being implemented in Africa, but we don't know because we don't have the baseline. We don't have the statistics.
Great, thanks. So building on the question before last, which sort of asked about extending into the community, there's a question that says, what about ensuring that ethical, AI is introduced into secondary and high school computer science curriculum? Because I think really there's going to be a very rapid move to AI training and education. Not for, I think I'm past that curve at this stage, but really it's going to be something that'll be close at hand and taken up by younger generations. Have you given any thought about how you might extend your education outside of university, but into secondary and high school training?
That is the best statement I've had today, because it is already getting out there. I mean, someone is already thinking beyond health, and that is education. I was trying to narrow down to health and bringing in education, but in terms of health. But that is the best thing I've had, because we talked about revolutionizing the health sector and education. And now someone is coming. I should know who that is. Thank you very much. I think that is a great move forward. Yes.
Great. Now, I understand, and you didn't mention this in your talk, Rose, your interest in building a sort of African network. Because one of the questions is, how is it possible to speak on behalf of the entire continent of Africa? But I know, so you're starting from Tanzania with a bold vision, but if you could maybe speak to your plans and aspirations to have a wider network of African countries involved in this AI ethics initiative?
Yeah, very interesting question. I After listening to the conversation and my 6 week stay in the University of Toronto, I feel like I could speak for Africa, because this is I wanted to hear something that is going back north, and I did not. And then I just thought, now I have to speak for Africa, because at this level the conferences were very, very widely represented, and I didn't hear Africa. So I thought, now I am here, I have to speak for Africa. That's one. But I'm also calling out for people who are actually listening out there, and in their way, in their countries, whether it's West Africa, East Africa, or North Africa, wherever, they really need to do the same thing and listen to how are we represented. I might be biased, but I am also saying that I did not hear Africa. And that's why I'm saying Africa is underrepresented, based on my 6 week stay and communicating with a lot of people and listening to all this. The AI index is huge. I mean, it's a big thing that has been the survey from the global survey is huge. I think someone from Uganda or someone from Malawi will agree with me, might ask the same question that I asked. And if that makes me represent Africa, then I'm going to represent it.
Yeah, and I think, you pointed out at that, during the World Health Assembly, when they had that special seminar on AI, there was again a lack of representation from Africa at that panel. Another question comes up, maybe so, and this one comes from Jennifer Gibson. Wonderful presentation, Rose. Thanks for sharing. The AI curriculum with us, and AI adoption often depends on organizational culture and policy. Would you consider a module on organizational ethics and in your curriculum?
That one is, I treat it like the school education part, because it's bringing in what else we need to include to enrich this curriculum. And I think the foundational course, we can include the organizational policy, because we want the policy makers to understand what is on the ground. And I think this is a perfect idea. Thank you, Jennifer, for that, because I think when we are tailoring for specific for policy makers, this is what we can actually bring in. And even for the postgraduate medical students who are future policy makers, this is a must know. Thank you for that. I will include that in the curriculum.
Great. And Jude Kong has asked a question, and it says that the African Union has been keen on AI governance, and there's been a lot of discussion around the world in that. Do you know the role that ethicists are playing towards framing the AI governance framework for Africa, and are they actually informing that framework?
Yes, thank you, Jude, for the question. I think Jay and others have already talked about that in the papers on the governance of AI and AI ethics. I think this is a work in progress. I think the Global Forum for Bioethics in Research discussed that as a work in progress. And I think from the WHO now, last 2 weeks, we know now that we have to improve the governance, and they are even willing to support in whatever way. So I think that the governance issue is in the pipeline. And what we need to do is to wake up and move forward and implement.
And that's going to be one of the things you do when you get back.
Yes, sure, I will do that.
Yes. Another question's come in is, so aside from improving, from training, are there any other recommendations you might have for improving awareness for AI in healthcare in Africa?
Yes, thank you for that question. There have been many ways of improving AI in Africa, and one of them is infrastructure. I think I mentioned about assessing the infrastructure, and I know people from Tanzania, they know, like, there's some memes moving around and thinking that AI is about us. Maybe it's a joke, but thinking that AI is a certain robot. So it sounds like a small joke, but I think it has a lot, it says a lot to do with the infrastructure. How can, if we really want Africa to be ahead of, to move ahead with this technology, then we really need to join hands and improve the infrastructure. Because if it comes to research, we will involve Africa, we will involve Asia, we will involve everyone. But when it comes to AI, then Africa can only be involved if the infrastructure is good. So I think that we need to move to work together as collaborative networks and improve the infrastructure in Africa.
So I'm going to ask another question. We're getting almost close to time. So imagine you've been given all the resources you need to bring your vision forward. What would be at the top of your wish list to move on first?
Tricky question, Ross. If you give me millions, I'll try to make sure that all the policymakers, the ethics committees, researchers who are involved in AI research, and medical students get the foundational course. This is not easy, especially in Africa. If I can start from my own institution and teach that group, but moving to Kenya, moving to Uganda, moving to West Africa, we really need to join hands, and this means that that's some funding that is required. So knowledge is power, I'll say that again. And any amount of money I get right now would to make sure that at least I prepare the fundamental knowledge, the foundation for AI understanding in Africa, and before I move into anything else. And also do the research. I think some baseline research is important. So I will do research, baseline studies, and then I will also train.
Excellent. And another sort of follow-up to that, as you finish your time off here in Toronto, are there any special things that you'd like to, reflecting on your time here, was it, well spent? Are you glad that you chose to come to Toronto? It was, when we were planning the visit, I said, don't come in February, but so, come in the spring. But maybe just before we conclude, if you could just give us a couple of reflections on your time here, how it's been, how could have made it better, and going forward.
Well, thank you very much for this opportunity, because it allows me really to talk about University of Toronto and the people I met. I didn't think that I was going to be so busy. I was moving up and down and all these appointments, and everybody was very good in talking to me about stuff, and especially the conferences that allowed me to actually reflect on what kind of curriculum this would be, the webinars, perfect the workshops, and the meetings with pros and the faculty. I have been very, very active, and I thank the University of Toronto for allowing me to be here. I got the fob.
Yes, yes. Yeah, there were some access issues that made it a little less than straightforward, but we got the fob so you could come into to
But I have to call the JCB to come back to the office.
It's good. So we're getting close to time. I see no further questions, so it might be time to draw this to a close. And I just have a couple of announcements to make before we thank our speaker. One is that for future seminar info, stay updated with our JCB event digest. And to sign up and receive the weekly seminar reminder and event digest emails, please email, once again, jcb.info@utoronto.ca, and we'll put that in the YouTube chat. Rose, I'm so thrilled, sometime back in Cape Town, when they made the random selection of which attendees at the conference would end up at which breakout groups, that you landed at the table that I was facilitating, that we managed to have many discussions at that meeting, and that you expressed an interest in coming and spending some time here at the University of Toronto. I think it's been a very mutually beneficial visit. I think you brought a unique perspective that people hadn't thought about, and that was one of the important things. And on the other side, it connected to, I think you've traveled amongst the AI world, in which many of us who live and work at the University of Toronto never get to see, through the undergraduate, through the Schwartz-Reisman, through CFAR, through Jude's work, through the JCB, Jennifer and Jay Shaw. So I think it's been a really nice and rich and rewarding time here. And from my point of view, I've enjoyed our conversations, and I'm grateful that you came to stay with us at the Joint Center. As I mentioned, you're here for a couple of more days, and if people want to get in touch with you, maybe we can put if you want people to get in touch with you, your email in the chat before we close down. And so if there are no further questions, then we'll draw this to a close. And thank you, Rose. Thanks for the energy, intelligence, the incredible curiosity and inquisitiveness that you brought, and your unfailing energy in making connections with people across campus. It's been a real joy having you here. So with that, I'll draw us to a close.
Thank you very much.
Okay. Thanks, everybody. Be well.